Hello, today again with healthy talk about gastroenteritis that we already started talking about. So, that is already we mentioned about that is mainly caused by the virus. Gastroenteritis is tummy bug, which has, uh, you know, quite a lot of impact on children's, but mostly virus, but others, bacteria, fungus also can cause gastroenteritis. So looking after a child with gastroenteritis, that is very important for parents, isn't it? So continue with normal feeding and drinks, including breastfeeding. Breastfeeding we always encourage, and it is very important to continue breastfeeding. Encourage the fluid intake, frequent and small volume. If you when you come to the hospital, initial treatment will be that we give the frequent and small volume. Vomits, if it's vomits, then wait for 5-10 minutes before trying to give further fluid, and it can be more slowly. You can use spoon or syringe. If the child is very young, it will be easier to push by syringe. Avoid fridge drink, high energy drink, undiluted fruit juice. Give milk, diluted juice or squash. So not diet one, yeah, and no added sugar varieties. And do not stop your child from eating if they want to. Do not give your child any anti-diarrheal medication. If it has the lot of diarrhea, then ORS means oral rehydration solution, that we call diarrheal, is very very common and available or everywhere. A painkiller you can give paracetamol for tummy pain. If you see there is a blood in the poo and constant tummy pain, then of course you have to go to the GP or call 111 in the NHS. Now you have to also important that you have to check for the dehydration of your child. So how can you see that there is any dehydration or not? You can see there is a dry mouth, tongue or lips, reduced number of wet nappies and passing less urine, sunken eye, very sleepy, very irritable, very cold hand and feet and mottled skin. So in that case, it is really, really important that you discuss with health professional or NHS for further advice. So treatment of dehydration is ORS. Darolite is, of course, I told you about. You can get from pharmacy, supermarket, or as a prescription. If it's not too unwell, you can give that. So it is very important that you keep it, quickly give it and start giving it. So sometimes they don't like, so you can give some squash to add to improve the taste. So if vomits, you can give very small amount. Okay, so and wait, feed 5-10 minutes I already meant. And of course you have to think about not to prevent the gastroenteritis. It very quickly spread from one to another. So wash your hand and your child with soap and water after going to toilet, changing nappies and before eating. Regularly clean the toilet at home with disinfectant and bleach. Do not share towels and flannel, etc. with your child. Wash soiled clothes separately. Soiled clothing and bedding should be washed at high temperature, about 60 degrees centigrade. Keep your child off school playground until at least 48 hours they have their last symptoms. And the child should not use swimming pool or for another 2 weeks after they are well. So diarrhea usually commonly lasts for 5 to 7 days, usually stops within 2 weeks. Vomiting lasts for 1 to 2 days, usually stops in 3 days. So this is nutshells about how you will take care of your child. Hope that helps, and I think you can be able to assess the child if they need to go to the healthcare professional. Hope this is help. We'll talk about it a little bit more next week. Bye for today.